Hi, I'm Dr. Robyn Roth, but my friends call me the Booby Docs, my popular social media account where I talk about breast cancer and breast health in an educational and fun way. I'm a board-certified radiologist who specializes in breast imaging and image-guided procedures. I'm also a 40-something Ashkenazi Jewish woman with a strong family history of breast cancer and BRCA, so I know a thing or two about breast cancer. And this is my podcast, The Girlfriend's Guide to Breast Cancer, Breast Health, and Beyond. If you or someone you love has been affected by breast cancer, this podcast is for you. Each episode, I sit down with top breast cancer experts, thrivers, provivers, and those that love them to bring you the breast information. So get ready to learn, laugh, and let's be breasties. This podcast is not intended for medical advice. Please refer to your doctor with any symptoms or concerns you may be having. Thank you, and enjoy the show. So I'm so delighted to be speaking to my friend, Dr. Liz O'Riordan, today. She is a UK-based breast cancer surgeon by training, and unfortunately, she was diagnosed with breast cancer at the age of 40 with 2 recurrences that forced her to retire at the age of 45. She has since dedicated her life to educating and empowering people affected by breast cancer. She is a speaker and author of Under the Knife, The Rise and Fall of a Female Surgeon, which I am so excited to read, and The Complete Guide to Breast Cancer, How to Feel Empowered and Take Control. So thank you so much for being with me today.
You're welcome. I can't wait to chat. It's going to be great.
So you trained your whole life to become a breast surgeon, and finally you land your dream job, you marry your dream man, you're competing in triathlons, and at age 40, you were diagnosed with breast cancer. Tell me about how you were diagnosed and what that was like for you.
Well, I'm going to be honest here. I never checked my breasts because I thought it's never going to happen to me. And I'd had a couple of cysts. And one morning I got out of the shower and I noticed a lump in my breast. And I just thought it's another cyst. But I went to get it checked out and my mammogram was normal. But I had an ultrasound and I saw a 2.5 centimetre cancer on the screen. And I didn't need to wait for the biopsy. My surgeon came in and said, "Who do you want to treat you? Because I'm not sure I can." And a lot of doctors have weird cancers. So mine was mixed ductal and lobular, occult on the mammogram. An MRI showed it was actually 5.5 centimetres. So I had chemo first to try and shrink it down, which worked. And I then had a mastectomy and implant, and there was actually 13 centimetres of lobular cancer left in my breast, and it had spread to 3 lymph nodes during chemo. It was one of those really, truly occult lobular cancers.
Wow.
So that meant radiotherapy and tamoxifen and Zoladex, and I realised I'm having every treatment I give my patients, and I have no idea what they're like.
I can't even imagine what that must have been like for you. I mean, as doctors, we know so much. It's almost like you know too much because you know, but you don't know exactly what the patient is going through. So you got to walk a mile in their shoes.
Yeah. It's like you don't know how bad chemo is. You prescribe it, but when it's not until you are going through it and you think, oh, this is what being tired is, and this is what pain is like, and this is what it's like to lose your hair. It was eye-opening.
How did your perspective change on everything after you were diagnosed?
I think, first of all, I hated being out of control because I'm a surgeon and I didn't like things being done to me. I wanted to tell my surgeon, put the scar here and use these stitches and the drains. That was really hard. I think we are very good at treating patients in the hospital, but we are very bad as a profession at helping them live when we say goodbye. And I know we're going to come to survivorship later, but it was suddenly, oh, you're instantly menopausal and you're infertile and you have chronic pain and you have all these symptoms and no one knows how to help and off you go. And it was a real breast cancer is for life. The symptoms are collateral damage. And I had no idea because patients don't tell us. We see them after their diagnosis and their surgery. We see them at 1 year and 5 years in the UK. They don't tell you what's going on in between those appointments.
Something you said on your website that I really loved is that you said the illness I devoted my life to had robbed me of my breasts, my fertility, my libido, and my job. That is very, I mean, that hits right here.
It's like I defined myself as a surgeon and I had big, long, thick, wavy hair and I was newly married and thought about having children and suddenly my career's gone. I have no income. I have no status. I don't know how to define myself. I can never be a mother. I've lost my ovaries, my hair, my breast. Am I actually a woman? Everything you'd give to someone transitioning, I don't have. How do you flirt when you don't have hair? And it was I was a shell of my former self. And I think anyone going through this, you have to wake up and get on with every day. You have no choice. It's the roller coaster you're on. And somehow you think, right, today I'm going to find a way. I'm going to get through the day. And you find this new purpose and you find this new way of coping because you have no choice.
How did your diagnosis change your purpose, right? You had to totally veer where you were going with your career.
I think it helped me discover who I really am. Because as a surgeon, I was unhappy. I'd had suicidal depression twice through the stress of telling 10 women a day they've got breast cancer,
Wow.
long hours, very isolating, no real social life. That was my job for the next 20 years. And suddenly I had the chance to break my life down and see how unhealthy it was. I didn't see a lot of friends. I wasn't doing stuff for fun. I wasn't doing stuff for charity. It was all work, work, work. And it kind of made me realize deep down in my core, all I want to do is help people / hedgehogs / animals / birds. And I'm going to do that. And I have to find a new way to be able to make a difference in the world if I can't be a surgeon. And I started blogging and that just kind of led to one thing to another. And it's where I am today. And it's crazy. This is going to sound weird. I still don't get the impact of everything I do because most of it's online. I'm just trying to help people. And then when someone cries and says thank you, it's like, aw.
You are helping so many people. I mean, your books and your online presence, like you are just, a vision of what, breast cancer, how it could change your life. Obviously there's really hard times, but it gives you more purpose and it really helps you analyze what, my friend described it as a life quake. It shakes you to your core and makes you reevaluate everything you've done to this point and where you want to go, in the time that you have.
And I still had really bad days, all right, crying for weeks, really bad depression, thinking, what's the point? There's no point carrying on. There's no point planning for the future. Angry, it's not fair. I had all of that. And I'm getting better at sharing that online. Because if all you put is say how wonderful life is, it's not realistic. But there are good days. There are more good days than bad.
I think it's so important to share the good and the bad. I think that, social media can be a highlight reel and it really needs to be everything because, I've had people say, how do you have your stuff together? I was like, oh my God, like if you could see my brain, my messy house, my cluttered thoughts, like it's not pretty. So I think that everyone, every story has multiple sides. There's multiple sides to every story. So how did you get through those hard times? I know I saw that exercise really played an important part in your treatment.
So I think a lot of it was writing. My husband suggested I start a blog back in 2015 when they were a thing. And it was a way of getting me out of denial. I still don't think I've had cancer 3 times. And my family lived hundreds of miles away. And by keeping a blog, it was a way of explaining to them what was going on. But it kind of, by writing it down, it made it real. And I discovered people were reading the blogs and I could help them. And that helped me just come to terms with what was happening because I know too much. I've looked after women who younger than me who've died of breast cancer, and it's still really hard having that inside my head. I did no exercise at school. I hated it. I can't throw a ball to save my life. I was a cycling widow, and that's how I got into triathlons. When I'm exercising, I'm just Liz. I'm not a cancer patient. I'm not suffering. I'm just me. And that was my mindfulness. And that helped me just get a grip being out in nature. And even today, just sitting in the garden, listening to the birds, that can put me in a happy place and realize there's always joy somewhere that you can find.
I love that. One of the biggest fears that anyone who's been diagnosed with cancer faces is the fear of recurrence. And unfortunately, you have now faced that 2 times. How did you discover them and how did that take an emotional toll on you?
Well, I'm going to go back to the first day I was diagnosed. I was up at 3:00 in the morning reading metastatic cancer blogs. And I told my patients, don't Google, but it's the first thing we all do. And I had to scare myself silly to see how bad it could be and then come up from that. And I think every day for the first 3 or 4 years, I would wake up thinking, is this the day it comes back? Is a cough or a cough? And is a headache from banging my head on a low beam in my house actually brain mets and can I have a CT head? I didn't get that fear of, is today the day?
Yeah.
I've had 2 local recurrences, so they're not metastatic. I'm still cancer-free. And the problem is they are very rare, about 1 to 3% of women. There's no data, there's no trials. You're like this really lonely club. The first time, a radiotherapy had turned my implant into a hard, painful tennis ball that was being pulled up towards my armpit. And I'd had enough of swearing and pain. I was going flat. And I'd had scar tissue in my armpit. I'd been having physio on it for 2 years. And my surgeon said, let's just ultrasound it. And that was a 2.5 centimetre recurrence. And I've got expert hands. And I didn't know that's what it was. And I knew early recurrence, more likely to get Mets. I'm not going to plan anything a year in advance because I'll be dead. You go through this. And the hard part was I had more surgery and another dose of radiotherapy, knowing it could ruin my life and stop me operating with the side effects of shoulder mobility. And it was that, how much is my life worth? It's quality over quantity. And it stopped me operating. It stopped me doing a lot of things. I wish I'd never had the radiotherapy, but you make those decisions at the time. The second local recurrence came out the day before my book was launched, my memoir, and I just noticed a spot above my mastectomy scar. And I knew it's like that typical little ulcer, but I never told my patients what to look for, which is why I put videos to say, you see a little spot, and it got bigger and bigger. And I turned up at the clinic, it's a local recurrence. Yeah, it is. We'll do a biopsy, more surgery. And again, having had two, my surgeon said it's like weeding the garden. Some women just keep getting local recurrences in the skin and you just keep stripping bits away. But there's that fear that it will come back. And I think I've now realized, because you can go onto all the programs and get your odds, it's 90% chance of recurrence, whatever. It's 50-50. It comes back or it doesn't. And I have no control. I have the bum injections, I take the tablets, I exercise most of the time, but I need to stop worrying about things that I can't control and focus on what I can.
I love that. So you said you wish you didn't do radiation therapy.
Yeah.
A lot of women are prescribed radiation therapy. Oh, I just lost it. Sorry.
Yeah. I had to have it the first time, and that is part of standard breast cancer treatment. I have no concerns about my first radiotherapy for primary breast cancer recurrence, because that reduces the risk of it coming back.
Yeah.
And that's important. I had a recurrence in an area that had had radiotherapy. And my oncologist suggested giving me another round of radiotherapy using protons in the same area to try and stop it coming back again. Because if it did, we're talking about removing rib cages and major cardiothoracic surgery. But she said, doing it twice in one area can ruin your quality of life and ruin the arm and ruin nerve function. It was that. She's only done it twice. She's asking me what to do. I'm not an expert. I don't know. I couldn't live with the guilt of not doing it and it coming back.
Yeah.
And you take that risk. And in hindsight, I would do the same thing again. But it's hard living with the collateral damage.
Yeah. I think that you bring up so many good points is, our breast cancer treatment is not without its side effects. And you yourself said that you have suffered the collateral damage of many of your treatments, including radiation and tamoxifen. So how do you weigh the benefits of lowering your risk of recurrence versus quality of life and just how you're able to move forward?
It's really hard. So I had a big cancer. I was young with nodes, so my risk of recurrence was higher. So the benefit for me for tamoxifen was higher. But you don't know how bad the menopause is going to be. And as a surgeon, I knew all the trials that showed it can halve my risk of it coming back. But then you are in an instant menopause and you're not sleeping with the night sweats and you have the hot flushes and the vaginal dryness and no one's telling you how to cope. And I wanted to throw my tablets in the bin because they made me feel so shit. And now we know there are so many different treatments and things that can help, but it's hard. And I think Instagram is a bit like TripAdvisor. There are lots of people saying it's shit, it's shit, it's shit. You don't hear the people saying, actually, it's fine. It settled down after 6 months or so.
Yeah, I think that's a really hard, it's a hard conversation. And no, it's not one size fits all, like breast cancer treatment,
No.
Right? I think you have to weigh a lot of different things and weigh your personal values and what, is important to you.
But I think, I'm going to interrupt here,
Yeah,
sorry.
of course, please.
I think every person prescribing hormonal therapy should tell women and men these tablets are going to affect your quality of life, including your sex life. And there are lots of things you can do to help, like CBT, exercise, sleep, diet, alternative treatments to HRT, and we can help with lube and Vagifem for the sexual problems. Tell them that from the beginning and tell their primary care practitioners to prescribe this stuff if they need it, rather than us struggling for years, wondering, where do I go for help?
I think that's such an important point. A lot of doctors, we don't think about what it actually looks like, and so you've seen both sides, firsthand, unfortunately, every side of it.
Yeah.
So I feel like you have such an incredible position to educate both, patients and providers. So thank you for putting yourself out there in this way.
It's really rewarding speaking. And I'm not blaming doctors because we don't know. I used to say, you'll get a bit of vaginal dryness and a couple of months of hot flashes, off you go. And some women have that, but I didn't. And you don't know what you don't know. But I think we can now digitally signpost women to sensible resources, tell them it might be bad, and if it is, we can help from the beginning and help them rather than struggling.
I also think it's a really important point to educate the patient as well, because, you said a lot of doctors are not entirely familiar with, they know the side effects, but they don't really know what it looks like in real life. So educating people about what they should be asking for when they are prescribed these type of medications. So let's say somebody's prescribed tamoxifen and they have that horrible vaginal dryness and the menopause symptoms. What can they do?
So we now know the first thing is lube. I thought lubricant was something that prostitutes use and bad girls. It's like you don't talk about it, but actually lube makes sex more fun. It reduces the painful friction. Everybody should be using it. And there are 2 lubes I recommend, Yes and Sutil, that don't have all the chemicals and the glycerins and coarse thrush. That's the first thing to use with you and your partner. The second thing is vaginal estrogen is now safe for anybody. The latest study in the JAMA this year showed it doesn't increase the risk of recurrence. And my oncologist is amazing. I've had anastrozole, letrozole, Faslodex. She's still happy for me to have it. Because your vagina is like a tube of sandpaper, and it's not just penetration that's painful. I'm a cyclist, and I was getting labial paper cuts after an hour on the bike, and the UTIs. And telling people up front, and then saying, there are lots of drugs you can have instead of HRT to help with the hot flushes and night sweats, but they're used for other things. So you're being given an antidepressant to help with the hot flushes, not because your doctor thinks you're mad. But the big thing for me, we need to tell women about the importance of regular exercise and a healthy diet and trying to decrease their body fatness and cutting down alcohol, because they can reduce the risk of recurrence by 1/3. And there's no side effects. And it improves your bone strength and stops you dying from heart attacks and strokes.
100%. And also, if you have not been diagnosed with breast cancer, it does lower your risk of breast cancer. But I always tell people you can do everything right and still get breast cancer. Like, you were healthy, you were young and healthy at that point.
I was a fit 40-year-old triathlete, no family history. I did drink like a fish at medical school. And I wondered, is it my fault? Because I had a very unhealthy life. I rarely ate vegetables. As a junior doctor, you don't have time. But it's generally bad luck. And if you told me at 20, don't drink alcohol because you might get cancer, I'd have said, I'm a doctor. Of course I'm going to drink. Don't be silly. I'm young and I'm immortal. It's really hard getting that public education thing. But exercise can help with all the side effects of breast cancer treatment and help. If you exercise hard, you sleep through the hot flushes, but it can be really hard.
I think it's a really good point also that lifestyle modifications are an important part of breast cancer, lowering your risk and also a part of your treatment and keeping you sane during the treatment and through survivorship. So definitely agree with that. So what does survivorship look like for you?
Oh, as a surgeon, it was pretty scars that I could show pictures of at conferences and women flashing me in supermarkets to say, look at my nipple. So I don't recognize you, but I recognize the breast. As a patient, I want to be living. I don't want to be alive. And it's learning how to handle the side. There are no research into the side effects of tamoxifen. We're meant to get on with it. I think it's knowing that I can help cope with everything that's happened to me so I can get my quality of life back. And doing everything I can to live and reduce the chance of that happening. But it also made me realize, I use a thing called the wheel of life when I coach, where you can split your life up into sections. I talked a bit about this earlier. So work, fun, reading, faith, relationships, romance, food, health, charity, all of that. And money, I used to put the bills in a pile and not open them because my credit card was like way, way high. And actually stopping and saying, my life is really unhealthy and I'm going to spend more time with friends and I'm going to do things for fun and I'm going to look after self and prioritize myself, because I think women are very, very bad at putting ourselves at the bottom of the pile. and actually being a bit selfish. And I used to tell my women, you need to be selfish. You need to look after my women and men, you need to look after yourself. And there's no point giving women and men the best treatment available if they're miserable and their partners leave them and they don't like their job and they're in pain.
I think that's, you so eloquently talked about what survivorship looked like. It's complicated, it's messy, but at the end of the day, you have to prioritize yourself and your health and your mental health and all those things that are really important. And the other things can wait. It's okay if you have a messy house. It's okay. I think
exactly.
I have to tell myself this too.
And you're good.
Yeah.
You're good 80% of the time. I'll still eat a packet of chocolate biscuits if I'm feeling emotional or have a glass of wine. You can't be good all the while. You've had cancer, for goodness sake. And if you can't get your life back, you go to your doctor and you say, I'm struggling with depression or I'm struggling with this. Can you help, please?
Exactly. And I think that's an important point as well, of knowing when you need more than just, an exercise or going outside for a walk, when you really need the antidepressants and the you said CBT, cognitive behavioral therapy. So the therapy can really help. Yeah. Finding a coach, like you said, somebody that maybe even has been through this that can help you directly is a really important piece as well.
Yeah.
So when you were diagnosed with breast cancer at age 40, did you have any risk factors? Was there any family history?
No, none at all. I was the first person in my family to get breast cancer and the first person in my group of friends. I didn't know anyone else who'd had it. I was the first person going through it. And I exercised and I was fit. And I think that's why it's hard to sell exercise when they say, look at me, well, you're slim and fit and a triathlete and you still got it. What's the point? But I am convinced that being healthy helped me cope with chemo better and helped me recover better every time it's come back. And by carrying on exercising, it proves that cancer can't take everything away from me. And I'm grateful for my body and everything it's been through, and I want to look after it.
That's incredible. And you still have competed in triathlons, right?
Yep, I did a sprint triathlon during chemo in a pool very, very slowly. I had to beg them to let me do it and promise that I wouldn't be stupid. And it took 2.5 hours. But that feeling of crossing the line, bold as a coot, just smiling, thinking, I did this. And I did a half Ironman a year after finishing treatment. And I swam 2 miles in the local river and I cycle up mountains. But I've had to get rid of my type A surgical personality. I don't want to compete. It's fine if I'm last. I still get a medal. I'm just doing it because I enjoy it rather than my time on Strava is 3 minutes slower. I'm shit at this. It's like, I'm just exercising because I love it and I can.
I love that. You're making me want to go to the gym after this.
Yes, lift heavy shit. Seriously, exactly. I love getting in the gym and lifting heavy weights and seeing the changes in my body. It's amazing.
I love that. I'm gonna go get dressed after this. But you brought up an important point that most people who are diagnosed with breast cancer do not have any family history or the known risk factors. Yeah. So it is important to, everyone is at risk for breast cancer. The two biggest risks for breast cancer are being female and getting older. So everyone is at risk. And I think that's an important point. I forgot, when you were 40, in the UK, what's the screening age for mammography?
So in the UK, it's 50 to 70, and you can self-refer after the age of 70 every 3 years. I know the States have done it to 40. I think we think the jury's out, and I've seen some questions coming up about dense breasts, and I've got a YouTube video coming out on that at the moment about how mammograms aren't accurate when you're young because your breasts are dense and they can miss them, but there's nothing else. So it's we're going to go on to mammograms, I know.
I want to talk about the dense breast tissue and mammography because, so the recommendation in the United States is 40 every year in average risk women, risk being a key word. So women that are high risk, you could find your breast, you could find your breast cancer risk score by Googling the Tyrer-Cuzick calculator, TYRERCUZICK calculator. Yeah. I'll put that out. But so if you're over 20% lifetime risk of breast cancer, you want to start breast cancer screening as early as age 25 with MRI and as early as age 30 with mammography, and kind of alternating every 6 months.
Just say in the UK, we go by how many relatives are affected. And we put that into a chart, and then we will say, right, you need screening from 25, 30, 40. So we have a similar thing.
Right. So, but mammography is not perfect, okay? No. So we know that about 50% of women have dense breast tissue. dense breast tissue makes it harder to find small breast cancers using mammography alone, especially your type of breast cancer, the invasive lobular. And dense breast tissue is also an independent risk factor for developing breast cancer. So I like to say it's a double-edged sword. So I always recommend that anyone who has dense breast tissue consider having a supplemental ultrasound or MRI depending on your risk factors. So if you're high risk, then I would recommend adding an annual MRI. And if you are intermediate or average risk, I would say consider adding an ultrasound as well. That lets us find smaller breast cancers at an earlier stage and with better outcomes. And the only way to really know your breast density is by reading your mammogram report. So under your mammogram report, there's an important section called breast composition. And there, the radiologist will assign your breast one of 4 densities. The ones that are considered dense are heterogeneously and extremely dense. So if you see that, that means you have greater than 50% dense breast tissue, and you should consider adding supplemental imaging. The downside of any supplemental imaging is that we might find something that is not breast cancer, but we might need additional testing or biopsies to exclude breast cancer. But at the end of the day, you should get an answer whether it's anything to be worried about or not, and hopefully you can move on with your life. So I think it's really what you value. If you value early detection.
Yeah. So that's the States.
Yeah.
Say in the UK.
Yeah, tell me.
It's not compulsory to have your breast density on your mammogram report. And I think the problem is we don't know what to do with women with dense breasts because there are no studies to say that supplemental screening saves lives. Because we do mammogram screening because it does save lives.
Thank you.
We don't know whether the additional ultrasounds and mammograms and MRIs do actually save lives. So there are trials going on to look to see. We know ideally you should have supplemental screening, but we don't know what and how often. But we are now starting to think about it.
I think it's a really important piece is that, the cancer screening really differs where you are located. I know in Canada that it's 50 also, and they're trying to get it pushed to, 40 every year.
But do you have this? So in the UK, less than a third of women went for their first mammogram screening.
Why is
50,
that?
We don't know. It dropped during COVID, but only a third of 50-year-olds in London went for their first mammogram screening. And mammogram screenings only work if 75% of all women are going.
Ooh.
You need to have a huge amount of the population going to make it worth doing to pick up the cancers and save lives. So if women aren't going for a mammogram every 3 years, what are the odds of young women going for a mammogram every year? So the money to introduce a screening program when the current one isn't working, it's really interesting.
Wow, that's a tough one. I think that you are going to play a critical role in this, my friend. You can save the UK. Liz saved the queen. Yeah. So I wanted to talk about mammography because I think both of us were recently very triggered by a doctor that shall remain nameless on social media that was spreading misinformation saying the mammography causes cancer and trying to sell another type of breast cancer screening such as QT imaging or thermography that is not approved. Yeah. So let's talk about that.
I have all the data because I've just done a video about this. So they say mammograms are dangerous because radiation causes cancer, and that is true. But you need quite a high dose. Now, technically, that's 50 millisieverts. One mammogram is the same radiation that you would get from just living for 2 or 3 months in your background in home. You get radiation from the sun and the soil. So a mammogram is just 6 weeks of being alive. Now, if you attend all your mammograms from the age of 50 to 71, your risk of getting a mammogram-induced cancer from that radiation is about 1 in 10,000 women. While your risk of getting breast cancer when you're 70 is 1 in 25 or 4%. So yes, mammograms do cause cancers, but it's 1 in 10,000 women, which is tiny, 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 tiny. And the dose is 10 times lower than that of a CT scan of your chest. But this doctor is selling a different story, isn't she?
Yes, she is. And it's really, I think it's very dangerous to kind of lead with mammograms cause cancer because even the National Cancer Institute said that, the benefits of mammography far outweigh any potential risk. So we know that mammography has helped lower breast cancer mortality by over 40% since the 90s.
But it's not just that. Screening reduces the number of women needing mastectomies and needing chemotherapy. But there aren't trials to show that because it doesn't save lives. But it's a huge reduction in treatment that you'd need.
Exactly.
Now, I saw a question come up about 3D mammograms because doctors are saying 3D mammograms are more accurate, but it's a massive dose of radiation. I've checked with the experts.
No.
It's not. The radiation is the same as a 2D mammogram. It all depends on how dense your breasts are. It is not higher. They are just as safe.
I'm the expert in this, exactly, and I agree.
Yes, you are. So am I right? Please tell me I'm right.
You are totally right. So what they used to do a 2D mammogram and a 3D mammogram. So it was essentially like it was a double mammogram for the moment, while we proved that 3D mammography is as good as detecting cancer. Now we know that 3D mammography is better than 2D mammography at detecting calcifications and early signs of breast cancer. So most places no longer do the 2D mammogram. They only do the 3D mammogram. So, and it is equivalent to the dose of a 2D mammogram, like you said, which is equivalent to about 7 weeks of background radiation.
Yeah.
And so by skipping mammograms, we saw this during the COVID pandemic. When women skipped their mammograms, they were diagnosed with later stage cancer, leading to more aggressive treatments and worse mortality. So, these doctors that are spreading this misinformation, it's really preying on people's fears of getting breast cancer or causing their own breast cancer by getting a mammogram. I don't want to get a mammogram. It causes cancer. No, it does not.
Yeah.
I mean, over your lifetime, it may like you said, lead to a small increase in breast cancer, but more likely it's going to detect your breast cancer at an earlier stage and lead to less aggressive treatments and improve mortality.
And often, what these doctors are doing is selling thermography, which they then run. And thermography is bullshit, pardon my
Totally
French.
is.
So it's based on, you can explain this better than me. It's based on looking at infrared patterns in the breast, implying that cancers have blood vessels, they're more vascular. But the point of screening is to pick up a breast cancer before it's tiny, before it's got blood vessels. And as a surgeon, they're not very vascular anyway. And women are paying 400 quid every 6 months for a scan that is pointless.
Exactly. Every so often I have a patient come into my office. They had an abnormal thermography and they needed to be worked up. And most of the time it's nothing. It's like, oh God, why are they doing this? And also I've had women come in with late stage cancer being like, I don't know why I've gotten thermography for the past few years. Thermography does not detect the early stage breast cancers that mammography can. Mammography can pick up early calcifications and some of the early signs of breast cancer that other studies do not. QT imaging is a type of ultrasound. We use ultrasound all the time as a radiologist, as a supplement, as an extra imaging test to your mammogram, but it does not replace mammography at this point. No. There are lots of types of imaging tests that I'm excited about. Like contrast mammography is honestly my favorite. Yes. I think that we use that a lot at my practice, and I think it's a great way to find small breast cancers, especially in the women that have dense breast tissue. It's kind of like a mammogram and an MRI had a baby. And it looks like a contrast.
And there are fast MRIs coming, aren't there? So you can do an MRI in 10 minutes compared to 40 it's better for screening.
Exactly. So there's
Should we just talk briefly about why,
No, please.
A couple of questions coming up. Why do we miss lobular cancers on a mammogram? Why wasn't mine seen?
So invasive lobular cancer tends to grow in a single file line, right? So it can be really hard to detect, especially on a baseline. Like your first mammogram, you had invasive lobular. That would be impossible to catch on the mammogram alone, because a lot of invasive lobular cancers are caught by subtle changes by comparing it to years and years of mammograms. So if it's your first, it would be really hard to tell whether something is there, especially if you have dense tissue, which I'm sure you did.
I did.
So invasive lobular often presents as a palpable area of concern that isn't even seen on mammography. It's really only seen. Ultrasound can be hard too. Like you said, you had a lot on MRI. So invasive lobular, unfortunately, is one of those sneaky types of breast cancers. And often invasive lobular tends to be multicentric and bilateral. So which is why we always tend to get an MRI in patients that are diagnosed with invasive lobular.
And most of them are seen on an MRI. So they kind of grow in sheets, as you said. But there are a small number of lobular cancers that aren't even seen on an MRI, which is what mine was. They're completely occult. We have no other way of imaging a breast. It's just we take it out. And that's why some people have lobular breast cancers removed and the surgeon needs to go back and do a mastectomy because there was tumor there that no one was expecting.
And I think that is also, this brings up an important point that, there's lots of subtypes of different types of breast cancer. So breast cancer is not just one disease. It's, really hundreds of diseases. And it really depends on the type of breast cancer. So invasive lobular, invasive ductal breast cancer, the most common, or ductal carcinoma in situ when it's in the duct, it hasn't expanded yet. And then on top of that, then we also test for types of receptors. So is it receptive to, does it have estrogen and progesterone receptors or HER2 new? All of these information will guide your breast cancer treatment. So it's not a one size fits all approach to breast cancer. And it's really why I always caution people when they're diagnosed with breast cancer to do a Google search, because unless you're looking up your specific subtype of breast cancer and your oncotype and all that thing, it's not going to be specific to you.
You cannot compare yourself with anybody else.
Yes, that's a very important point. I wanted to see if there's some questions that came in on social media. What we talked about.
Let's have a look.
Why did my grade 1 ER positive breast cancer not show up on mammogram diagnosed on ultrasound? Like we said, it could be that it was very small, especially if you have dense breast tissue, it could totally be obscured. And I think that's an important point, which is why I always recommend that people, consider supplemental imaging like ultrasound if they have dense breast tissue. And I am going to say this, I'm curious what your thoughts are on this, but I'm a firm supporter of the self-breast exam, a monthly self-breast exam. What are your thoughts on that?
I think it's really, really important, and I'm embarrassed to say I never did it. And I've spent the week traveling the UK talking to healthcare professionals, and at least 80% of the room did not check their breasts or testicles every month. You only know what's normal if you check them every month and you can tell a difference. And even people often have a mammogram and think, well, that's me for the rest of the year. It's not. You need to do it every month because a cancer can take 2, 5, 10 years to grow, and it may not be big enough to see on that mammogram, but 6 months later it is.
100%. I think that your body breasts. You are your own best advocate. And I always say, I think it's very confusing, and I'm going to use this as a point to talk about. I really disagree with the recommendation. Back in 2015, the American Cancer Society stopped supporting the self-breast exam. And I think that is a big mistake, especially that we are seeing younger and younger people being diagnosed with breast cancer. And a lot of these people are not being screened with this, mammography and MRI. So I think it's a big missed opportunity to not teach how to do a self-breast exam, because about 80% of young people find their own breast cancer through a self-breast exam. Most of the things that they find, thankfully, will be benign. But there's a lot of young breast cancer out there, and it's on the rise. So I think that we just have to be vigilant. This is why I always encourage the monthly self-breast exam. I always promote Feel It on the First as a good reminder, as a way to check your breast.
So I have a question about that. I first of all, I think people say screening doesn't work because there's no proof that it saves lives. But we're never going to have that study. You're young. There's nothing else available. You need to know.
Yeah.
I always told women who are premenopausal to feel it mid-cycle, because that's when your breasts are less lumpy and you're more likely to see changes. Although Feel It on the First is a great Instagram thing, I kind of no, actually, mid-cycle, if you're having periods, it will be easier to feel.
That's right. I think that, but
it's not catchy.
Yeah, it's not catchy. So the ideal time to check your breasts, or actually get any breast imaging study like an MRI, is to do it on days 5 to 7 of your menstrual period, which is, 5 days after your period, like you said, when your breasts are least tender and least active. Yeah. But again, it's hard to remember. So whenever you do it, just choose the same time every month so you know how your breasts feel at that time of the month. And then if you notice a change, pay attention to that change over the next few days, because if it's something benign, it typically will go away. But if it's something to worry about, it typically will get harder and firmer. And, this is the point where you want to start calling your doctor, trying to set up an exam, because often it can really take a few days or weeks to get in.
Yeah.
So making the phone calls to try to get an appointment, and then, get a really thorough breast exam by your doctor. But if they say it's nothing, it's just a cyst, I think this is a good opportunity to say, how do you know it's nothing more serious? Is there any imaging tests that we can do to prove that it's not breast cancer? Because likely it's a cyst, but also it could be breast cancer. And I see a number of women who have delayed diagnosis because somebody told them it's just a cyst, don't worry about it, you're too young to get breast cancer.
And luckily that view is changing. I think most GPs in the UK send anyone with any breast change up to a clinic to get a scan to see.
Good. I would like to see that in the US. Yeah.
It's hopefully coming, because it can happen in young women.
Yes.
How do the people listening to us today know who to trust? How do they know that we're right when we talk about mammograms compared to these different doctors in the States and the UK?
Well, I think that's a great point. I don't know that there's any way. I always try to say, if someone's trying to sell you something and they have financial gain from that thing, be wary. Just put your little red flag up, because maybe it's not in your best interest. Perhaps it's in their best interest. And look at the data that presenting, where it comes from, because it can be really tricky on social media, especially. You have doctors, but you don't really know if they have your best interests at heart.
No. And I think it's hard when they've got millions of followers. You think they're more accurate than someone like me who's only got 30 or 40. But I love that. Where's it from? Where is the proof? Can they back it up? And if they say the words might or could or maybe, there's no proof.
Yeah.
This definitely does. You think, well, okay. But the minute they bring in those words, they are doing it to hedge their bets. And you think, no, sorry, this is BS.
Hi, Nance Marie, who just said, Dr. Roth found my breast cancer. I'm so thankful for you.
Hi. sorry she found it. But
yeah, right,
great
exactly.
That she did.
Someone's got to do it. And,
Yeah.
So I also, sorry, you were saying.
No, go on.
I was just saying, somebody was asking why the rise in young breast cancer.
Yes.
I wish we knew the answer, and I don't think we know. And that's why we have to be very vigilant. My theories are a lot of lifestyle things that we do, like birth control. I don't know. I think part of me, I took birth control my whole life. I just wonder in the back of my head, and you're saying no.
The risk of getting breast cancer from 10 or 15 years of use of hormonal contraception is very, 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 very small compared to the natural increase in age. And this is a big, huge thing in the UK, because the worry is they say the pill is dangerous, and then women stop taking it and they end up with abortions. They get pregnant. Pregnancy can kill. Pregnancy is not a safe thing. So it is. I would much rather women took the pill, but actually exercise and ate a healthy diet. I think that is safe. I think it's lifestyle. I think we don't eat well. We don't exercise. We're very busy. Plus there's something genetic, because triple negative is a lot more common in younger women, especially in the Black community. And we just don't know why.
I also think that, even though you might not have a known genetic mutation, it does not mean there's nothing genetic, right? It may mean that we have not discovered the gene yet. And there's also familial, right? Like we know if you're having a first degree relative that was diagnosed with breast cancer, especially if it's premenopausal, is one of the strongest breast cancer risk factors you can have. So, and on top of that lifestyle, I think that we are living a more sedentary lifestyle. We're eating unhealthier. There's more access to vaping and all these bad things.
And portion sizes are bigger. We don't exercise. I think it's all going to add up. But what I'd like to say is, again, it's a bit like TripAdvisor. You suddenly think there's an epidemic of young women with breast cancer, but it is still a disease of the elderly. But your grannies aren't on Instagram talking about their recurrence. So your view is very skewed by what you see, but young women do need to check their breasts.
The recent data from the American Cancer Society actually showed that it was decreasing in the older population and increasing in the younger and middle-aged population. So I do think that it is moving. I always say breast cancer is not an old person's disease.
And again, the screening is helping reduce it in the women in their 70s and 80s, because screening is working. So.
Exactly. That's a great point to end on. I want to ask you, before I let you go, what is your best advice to anyone who has been diagnosed with breast cancer?
I'd say you're not alone. Mm-hmm. The biggest thing I did was to find my tribe by going on forums and finding people I could talk to who got what I was going through when your family don't understand it. And I think knowing there is help out there for anything you're going through, and you're not the first person to go through this, can really, really help. But it can be scary and it can be shit. And you don't need to share your life on social media. You can keep it private. No one has a right to know.
I think that's a really good advice. I think finding your community of people that are like-minded to you. Social media is a great way to connect to people who share similar values and are going through the same thing, especially if you're a younger patient, like the Breasties. And there's so many great organizations that really bring together young cancer patients that have been through similar life circumstances. And it's I think they say worst club, best members.
Yes. And I started a WhatsApp group for globally for doctors with cancer when you've been on both sides of the table, it's really hard. And just having those people, my husband thought I was having an affair because I'd be chatting away at 3:00 in the morning. There's always someone awake with a steroid insomnia from chemo. But I think having a supportive community can really, really help.
I like that. Somebody wrote in, I'm 62, I've had 5 cystic breasts, seldom do a self breast exam. My sister had breast cancer. I'm doing my annual with Fear now. Thanks for this forum. I think this is a good point. You know, sometimes people say that my breasts are lumpy. How do I know if something's concerning? That is your normal. Your normal is that your breasts are lumpy. But if something doesn't feel lumpy, it feels more hard or matted, that's something to pay attention to. And I just think that...
And check the other side.
Yes.
Because often they are the same, you're just feeling differently. And I always say, if you put a note in your diary of either you found a lump, or if you've had breast cancer, you've got a symptom you can't explain, put a note in the diary. Come back 2 weeks later. Is it still there? Get it checked out. If it's gone, don't worry.
Yes. And I think it's an important point to mention, you know, a lot of people are scared to go get checked. They're scared to do a self breast exam. They're scared to get their mammogram. They've been putting it off. They don't want to know what it shows. But ignorance is not bliss. Okay. The earlier we could find your breast cancer, the more treatable it is. So I just think it's like ripping the Band-Aid off. Nobody wants to do it, but you know, knowledge is power, and knowing that you may or may not have something just gives you, you know, the next step and you could face it head on.
The survival rates are improving all the while. And since I wrote my breast cancer book, there are 20 new drugs in the last 5 years. And the data we have for survival is already 10 years out of date. So things are getting better and better, and people are living longer and longer. So
if we
there
can
is
find
good news out there.
Most women are diagnosed with breast cancer at stage 1 and stage 2, and the survival rate is over 90 to 95%. So we are doing something right. Like there is some benefit of catching your breast cancer, you know, with mammography, with self breast exam. All of this helps us to lead to better outcomes and improve mortality. So thank you so much for your insight and your wisdom. And you are a beautiful, bright light. And I am so happy to have met you and share this valuable conversation with our listeners. So thank you.
Thank you, Robyn. It was great to chat. And thanks everyone for watching. Again, if you've got questions, send them to us. We're always happy to help.
Yes, you could find Dr. Liz O'Riordan. What's your Instagram name so people can
I'm O'Riordan Liz on Instagram and Dr. Liz O'Riordan on YouTube, where you can find all my videos explaining breast cancer treatment. And this is being recorded, so it will be up on your grid, won't it?
Exactly. It will be on my grid. It will also be on my podcast, The Girlfriend's Guide to Breast Cancer. And also make sure you check out Dr. Liz O'Riordan's book, Under the Knife, her memoir, The Rise and Fall of a Female Surgeon, and also The Complete Guide to Breast Cancer, How to Feel Empowered and Take Control. Thank you so much. Have a great day. I'm going to go exercise right now.
Yeah, great. Me too. Thanks, everyone.
Bye.
Bye.
Thank you so much for listening to this episode. If you enjoyed this conversation or learned something new, please go to Apple Podcasts and leave me a 5-star review and help spread the word. If you tell me you did, I'll give you a big virtual smoocheroo. And of course, make sure you follow me across all social media platforms at the Booby Docs for more of the breast information. And a huge thank you to my podcast producer, Christian Cuveta, an amazing medical student who also wrote and produced the music for the show. Take it away, Christian.